Okay, seeing that it's noon, we're going to go ahead and get started. This session is being recorded. And hello, everyone. Sauk County Public Health and Local Healthcare Systems present a virtual press conference on COVID-19, a call to action for all Sauk County residents. You are the front line, we are the last line. My name is Sarah Jesse. I'm a community health strategist with Sauk County Public Health, and I'll be the moderator for this event. Who you see on the screen here, you might notice that we're not wearing masks. This is because each of us is in our own individual offices. Whenever we get together, even in the office, when anyone enters into my office, I put on my mask and they're wearing theirs. So just want to say that because I know during this press conference, we'll be stressing the importance of these individual actions. So we're going to go ahead and introduce all of our panel members in the order that you see on the screen. So we'll go first to you, Jeff.
Hi, I'm Jeff Jelnick, J-E-L-I-N-E-K. I am the incident commander for the public health COVID-19 response for Sauk County.
And we can just proceed in the order listed on the screen if you would.
Hi, I'm Janelle Hupp. I'm a family medicine physician with Sauk Prairie Healthcare. Also the chair of our infection control committee and director of employee health.
Thank you, Dr. Hupp. And if we can go according to the list on the screen, can everyone see that? So it would be Jesse Phelan next. You should all see my document up on the screen. Is that correct?
Sorry, I was trying to unmute. I'm Jessie Phelan, nursing manager for Sauk County Public Health and operations section chief for the COVID response for the county.
Thanks.
I'm Jody Molitor. I'm a health educator and emergency preparedness coordinator for Sauk County Public Health, and I'm also the planning section chair for our COVID-19 incident response.
Hello, I'm Dr. Eric Warbass. I'm the ER medical director at Sauk Prairie Healthcare.
Good afternoon. My name is Nathan Grunwald. I'm a urologic surgeon and chief innovation officer for Sauk Prairie Healthcare.
Hello, I am Teresa Field. I'm a registered nurse and chief operating officer at Reedsburg Area Medical Center.
Hi, I'm Laura Walczak. I'm the hospital president for SSM Health St. Clair Hospital in Baraboo.
Good afternoon. I'm Jennifer Collada. I'm the Chief Nursing Officer at St. Clair Hospital in Baraboo.
Hello, I'm Dr. Maureen Murphy, and I am a family medicine physician at the SSM Health Wisconsin Dells Clinic and Chief Medical Officer at St. Clair Hospital in Baraboo.
Thank you. I believe at this time, all of our panel members have introduced themselves. I understand we have some members of the press present. We do ask that you please type your questions into the chat box for us. You can direct your question to one specific panel member if you'd like, or to all the panelists as you would prefer, but you can chat that out to everyone if you would please, all those questions. After we're done with our panel presentation, we will also open up the mic, so to speak, so you could also unmute yourself and ask a question, again, to one panelist or to the group as a whole. So without further ado, we'll jump right in here. Jeff, can you tell us, please, why have Sauk County Public Health and our area healthcare systems called this press conference now?
I just would like to thank everybody for being here. And really the reason we're here is we've talked with our healthcare professionals that are all joining us here today. We've really realized that we needed to do something more, and we needed to come together as a group and come together as a community. And really this call for action for people to really heed the warning that we are setting out there. This has been an extended emergency. We understand that folks are getting tired of COVID. It's impacting our entire county, our entire state, the entire nation. And we really need individuals to listen to what is coming out. You know, listening from our healthcare providers that are on these calls today that are going to talk about some of the things that they're seeing and doing. And one of the things that is, as we've gone through this, as I think about this, is our community is so generous and resilient. We come together in times. We've come together in floods. We've come together in missing individuals, and I can go on over the years that I've been here. And this is one thing that I have not seen with the COVID response. And we really are asking for folks, again, that call for action. We need people to work and listen to the information that's going out there. We've had an extended period, as I talked about, and this has really taken a toll. It's taken a toll on workers. I can know the public health staff is taking an emotional toll. We're not used to working in death and having deaths, and our deaths continue to rise on a daily basis. And it's something, after a while, it continues to take a toll. So we need individuals to follow with the 3 W's: wearing a mask, watch your distance, and wash your hands. And if we can get you to do those 3 things through the holiday season, we can hopefully curb COVID and be a safe Sauk County.
Thank you, Jeff. You have an excellent point there. You know, I've always seen our Sauk County community come together in times of crisis with an amazing outpouring of generosity for all frontline workers. So yeah, let's do this, Sauk County. Let's all step up together. Love that message. Jesse, can you tell us briefly about the COVID surge that you're seeing? What are current rates of infection in our county?
Sure thing. Can you hear me okay, Sarah?
Yes.
Okay. So as of November 23rd, our statistics lie as follows. Cumulative case count, 3,303 cases. Cumulative hospitalizations, 114. Cumulative deaths, 16. And current active cases, 870. So 26% of all cases are currently active. So just to talk a little bit about the doubling rate, it took Sauk County just under 7 months to reach 1,000 cases. It took just over 1 month to reach 2,000 cases. It only took 16 days to reach 3,000 cases. Our current doubling time is 28 days. That means if these trends continue, we could see another 3,300 Sauk County residents infected with COVID before Christmas. So really something to think about there. At the end of October, we forecasted the data on October's trends and estimated that in the month of November, we would see an average of 60 new cases per day for 1,800 new people infected in November and 50 hospitalizations and 6 new deaths. In the first 23 days of November, we've averaged 60 new people per day infected with COVID. 49 Sauk County residents have been hospitalized and 9 Sauk County residents have lost their lives to this virus. Unfortunately, what we have forecasted has come true.
Thank you, Jesse. Very sobering news. Let's turn now to our healthcare partners to see how this COVID surge has affected them. We're going to start with Dr. Warbass of Sauk Prairie Healthcare. What are you seeing in your area, Dr. Warbass?
Well, it's fundamentally changed our day-to-day experience of what it means to go to work. We've got a wing of our department that we kind of try to cohort patients, COVID patients to, where we've got a couple of negative pressure rooms that will, kind of keep the airflow safe. We try to cohort our COVID patients as much as possible over there. We've developed some enhanced cleaning protocols that take much longer but are more thorough, involving we use a ultraviolet light sterilization step that takes quite a long time, but it's felt necessary at these times. Obviously, we're all wearing PPE all the time, every patient. Early on, we thought we could get away. We thought we could sort of cherry pick who is likely to have COVID and who not, but that seems quaint at this point. I mean, everyone is suspect at this point. So we wear a minimum of an N95 mask covered by a procedure mask. We wear goggles, gloves for every patient at a minimum. And oftentimes when it does seem, more suspicious, we'll have a respirator on. It takes time to put on all this stuff. It's exhausting, physically exhausting and time consuming to put on and then take off. It's exhausting to take off the stuff, and you have to do it in the proper sequence. And I have to say, it's far worse for my nurses and my techs than it is for me. I mean, the nurses and the techs spend far more time at the patient's bedside than do the physicians like myself. But that's difficult. I feel like I have to say a word about testing, specifically rapid in-house testing, where we get an accurate result the same day. that remains a scarce resource. I don't know how long, 8 or 9 months in the pandemic, that's is vanishingly scarce. So usually what we have is a test that we send to an outside reference lab. Turnaround time of which is 2 or 3 days. So it's really hard. I can't really give a definitive diagnosis to someone who shows up with a concern for COVID. So that's something else that remains a challenge. But I think probably our biggest challenge at this point is that of finding a bed for patients requiring admission or transfer. So early on in the pandemic, that was for the COVID patients, of course. But you know, as our Madison partners, and we also at Sauk Prairie Healthcare, all of these facilities are opening up new COVID wings, COVID units, expanding their COVID sort of capacity. That's eased somewhat, and so we're finding that we are able to, you know, more easily take care of COVID patients. But the real challenge now, in light of our recent surge, is caring for our non-COVID patients. Because, you know, rooms and staff have been reallocated during this time. And so, as for instance, you know, I've personally cared for a head injured patient with a head bleed who was stable, you know, but you know, ordinarily speaking, we'd like to be cared for by a neurosurgeon or a trauma surgeon. But you know, there were no beds where those specialties, you know, they didn't have any beds in Madison, so we cared for them at Sauk, and you know, we did okay. I had a heart attack victim not long ago, a couple of weeks ago, who needed a catheterization. I couldn't find a cardiologist in Madison who had a bed that they were able to offer to the patient, so I had to transfer that patient outside of our usual catchment area. One of my partners had a patient who was very, very sick on a ventilator, and cared for that patient for, I think, 10 or 11 hours that day, while the support staff in the ER were calling literally the entire state looking for an ICU bed for that patient. I mean, they were calling La Crosse and Milwaukee and Marshfield, could not find a single ICU bed in the entire state. Eventually, Freighter in Milwaukee came through for us, and that patient did well. But I'm just saying, these are just singular, unique challenges. So business as usual no longer exists in the emergency department. You know, when I get in for a shift, I kind of put my finger in the air and check in with the nurses. How are we doing on beds in our facility? How's Madison? How's Madison's bed situation? And we kind of develop a game plan for the day. But, you know, the further we get into the pandemic, I mean, we're getting deep into our contingency plan playbook. And, you know, it just starts to feel surreal. I don't know, you know, when sometimes when you know, you do something a little foolish, maybe you you go off a ski jump, you say, I can make this jump, and you break your leg, you know, seconds later. I don't know if it's happened to anyone else, but you know, I'm like, oh man, I just wish I could turn the clock back and, you know, choose wisely and make a different choice, a better choice. I feel like these weeks that we're in right now, the last 3 weeks, I know that I'm going to be looking back on this time and thinking, you know, I wish we had just made a better choice right now, because things are getting really scary. I'm really honestly concerned for the future. These are the last 6 to 8 weeks have been the most challenging of my career of 20 years by far.
Thank you for sharing that. And how about our other healthcare systems in Reedsburg Area Medical Center? Teresa, would you like to share about what you're seeing there? Are you having similar challenges to those expressed in the Sauk Prairie region?
Yes, actually, everything that Dr. Warbaugh just shared, I could have repeated word for word. The challenges of having to care for patients that we normally wouldn't keep at our facility because we just can't get that ICU level bed down in the Madison area. So we start really looking at the extended, you know, regional networks of La Crosse and other areas to try to find places for these patients. And like you said, you know, we're taking care of a lot of them here, and you know, we're doing a good job. But just that in and of itself takes an emotional toll on staff also, because we're asking a lot of our staff right now. They're working short. They're being asked to do things that they've had to completely fundamentally change the way we're doing business in the hospital. And that cumulative stress definitely worries me. And then, you know, as we see this kind of the snowball continue to roll down the hill and pick up speed, and see that bed availability is becoming more scarce all the time, it definitely weighs on staff, and the capacity they have to just be resilient, I think it's less and less all the time. And so, you know, the time's really come. We need the community to help us out. It was in the beginning of this pandemic, I think there was a lot of adrenaline that we were all working on. There was fear of the unknown, and we were trying to make good decisions. But, you know, now 8-9 months into this, the adrenaline's starting to wear off, and now there's fatigue. And I just would, you know, make that plea to our community, to our citizens, that I don't think that we don't have the luxury anymore for our citizens, our neighbors, to feel like they are outside of the healthcare system any longer. I think our entire population in Sauk County has to consider themselves part of the healthcare system, because the choices that everyone makes is what's going to really give us that little bit of oxygen, that lifeline that we in healthcare need right now. You know, every potential exposure that is prevented through good action decreases the burden that we feel, and allows us to continue the work that our county needs us to do. And, you know, like Dr. Warbaugh said, it's not about just COVID, although that's what's getting the headlines. There's still healthcare needs. There's the heart attacks, there's the strokes, there's the traumas that we still need to have the capacity to provide that care to our community. But as we become increasingly overburdened by COVID, it becomes more difficult to do what our community really depends on us to do.
Thank you, Teresa. I love your plea to the community to join in the mission of healthcare to save lives. It is the time that we all become frontline workers so that there can be a last line of defense in the healthcare system. Really well said there. How about at SSM Health? Laura, would you like to speak to what you see at St. Clair Hospital?
Absolutely, and thank you. And I absolutely agree with and echo my colleagues at Sauk and Reedsburg. We have been going at this since the end of January. We put our surge plan in place. We converted an entire wing of the hospital to negative airflow so that we can maximize our ability to care for COVID patients. We have made sure that we had enough resources, masks, gowns, gloves, beds. We have plenty of beds. The real issue here now is, when is it a bed? And it's only a bed until we have a qualified caregiver, nurse, tech, physician to care for that patient. And right now, that is our biggest concern, the availability of our staff and the well-being of all of our employees that make up the team that cares for these patients each and every day. It is exhausting putting on layers of PPE. It is exhausting taking it off. It is exhausting working with a mask and goggles and a very warm gown and being in a room for lengthy periods of time. We're very concerned about the well-being and the availability of our staff. And it's not that the staff are getting COVID from our patients. The concern is that we are having staff being exposed to people in the community, to their loved ones. If they aren't sick themselves, they are being quarantined because they have been exposed to a loved one. That takes them out of the staffing for several weeks. It is becoming an issue, and the only way that we can stop this is through all of the things we talked about already. It is not exciting things. It is a change in the way we behave socially, which is probably the hardest thing for us to do, particularly at this time of the year where people need other people. We need to make sure, listening to Jesse and talk about the numbers, that's very sobering. If we don't stop all of the social interacting, it will only get worse. We are at or near our capacity every single day. I couldn't be prouder or more inspired by the team that we have working here and how they have come together to creatively ensure that we're caring for the community. And I certainly hope that the community starts to think about caring for the healthcare providers. I'm going to turn it over to Jennifer and Dr. Murphy if you have other things to add.
Yes, I certainly would like to say that we have availability and beds and staff in the shortage time. However, we planned our work and worked our plan for the surge. We are in our phase 2 of surge right now. We do have beds. We do have challenges within our staffing. COVID patients, not all of them require ICU. They aren't all going to go on a ventilator, but they are very, very sick patients, and they are taking up a long period of time in the hospital and using our beds. We are coexisting with COVID with continuing our hospital operations, but it isn't easy. What can we do to really help this? As we look at the trajectory of the COVID positive cases in our community, we need to please change, or we will not be able to flex up and send patients to our other hospitals because they will be full as well. You heard earlier about transferring patients. We are part of a larger system, and we collaborate across our Wisconsin ministries to see who has beds every single day, so that we know who has ICU beds, who has med-surg beds, so that we can meet the needs of our community.
Yeah, I guess, Jesse, the numbers she shared is one piece of the puzzle. What we are all, I know at St. Clair, are very, very concerned about is this holiday coming in a few days where we are having people go from one hotspot to another, planning to have meals with multi-generational families and friends in close proximity, indoors, for hours at a time. And if people don't change plans and just go on thinking that's their right to do that, which, you know, you can argue what is public health, except my rights end where your rights start to get impacted. But if that does go forward, Thanksgiving will possibly go on record as the most dangerous holiday ever. And the concern is that it will become a national super spreader event, and that some of those families and friends that you are going to be having dinner with, unfortunately, may be their last Thanksgiving. And so our plea is for people to please seriously consider what your choices are going to be in 3 more days. Thank you.
Thank you, Dr. Murphy. Dr. Hupp, we haven't heard from you yet. Would you like to share more on what's happening from your perspective in the Sauk Prairie area?
Yes, thank you, Sarah. I think that when we think about the whole continuum of care, that includes a safe discharge plan for patients. And, you know, we hear from Dr. Warbass what's happening in the ER, and we hear about what's happening in our acute care settings. But the next leg of the journey for many patients is finding a long-term care setting. Many of them leave our hospital and they aren't ready to go home. So they need a stay in a skilled care unit, or they may need home health. And it's been a real struggle for our care continuum team and our social workers to manage these patients. I had a conversation recently with our director of care continuum, and she described this as it's like a Jenga game, and we every day look to see how we can piece a care plan together for patients who are being discharged. And it's not for lack of trying on the nursing home's part. They are struggling with the same things that we are in the hospital setting. They have staff shortages because people are out sick or they've been exposed. They have nursing home outbreaks. Right here in our service area, we have nursing homes who have high numbers of COVID positive patients. And not to mention the fact that we are oftentimes sending them sicker patients. Patients are scared to come into the ER. They're waiting at home. They're sitting on their chest pain and they're coming in they're more ill and they require higher levels of care. And oftentimes nursing homes aren't equipped right now to manage those sicker patients. So all of this has created a lot of difficulty in getting patients discharged from the hospital. So we're seeing longer extended patient stays. We recently had a situation where a patient was ready for discharge, but it took phone calls to 20 different nursing homes, skilled care facilities around our state. So we're now, our search is extending to places far away from Sauk County to find beds for these patients. So the 20th phone call yielded a bed out in Muscadet for a patient from our Sauk hospital. So these situations are not ideal for patients. They're not ideal for family members. Eventually that patient is going to have to be transferred back into a nursing home or a facility near their family. Those sorts of transitions for these sick, frail patients are not easy on them. So it is really creating a conundrum from that, the next step of care for patients. Home health too is we are sometimes calling 4 and 5 different home health agencies to try to arrange home health care, and many times they can't get out to see the patient even in a timely manner because, again, they're short-staffed. They're being pulled in lots of different directions right now. So it's really of crisis proportion when we look at even beyond our hospital issues. So, I really think that this is, it's a battle, it's a war. And when I think about the history of the United States and how much respect we have for sacrifices that our men and women in uniform make for us, I think this is a war right now. We're in the battle and the boots on the ground have to be us. We have to recruit our family members, our neighbors, our county residents to do the right thing here and not go to their family Thanksgiving dinner and not, congregate in places with large numbers of people. Stay with your family, mask, and with your immediate family. And, hopefully we can stem the tide. And, Dr. Grunwald's going to give us hope on vaccines that are on the horizon. And we just really need to hang in there. I get that people are tired of making the sacrifices. We all are. But think about how we respect the sacrifices that our military have made for us in the past and recognize that we're being called upon to do just that right now for our friends and neighbors and other residents in the county here.
Thank you for that call to action, Dr. Huff. Love it. And I also wanted to point out too what you said about how people are waiting to come to the ER. I'm sure all the healthcare providers on the call would encourage people to continue to depend on them for care and to come when you need care. Is that correct? I see a lot of heads nodding. I know that's
absolutely. We are here to care for you, and we want that message to be loud and clear. Don't sit at home on an illness that could make your care much more complicated.
Thank you. Would any of our other healthcare providers like to provide any words about how the COVID surge has affected their facility? All right, then we'll move to Jody in public health. Jody, we've been talking about this call to action and what people can do. Would you like to add anything more on how we can all work to flatten the curve again? Any additions that you'd like to make to the conversation at this point?
Yeah, thank you, Sarah. So just a reminder, because I don't think we can remind people enough of the most important things that as individuals we can do for preventative measures. You know, washing your hands with soap and water or alcohol gel after coming in contact with any high touch items. Wear a mask every time you leave your home and watch your distance. This means, you know, plan ahead for when you must leave your home to be sure that you're able to keep 6-foot distance between yourself and those not in your household. Sauk County Public Health, along with Wisconsin DHS and the CDC, asks you to stay home and celebrate the holidays with those from your household only. If you choose not to follow this guidance, we are asking that you plan to quarantine or stay home for 14 days after your last contact with those outside of your household. This is just a really important step. You know, if you choose not to follow the guidance, we need to make sure that you're not going out into our community and spreading the virus if you did come in contact with that. And this would be regardless of a negative COVID test, because, you know, a negative test only tells you what you're seeing in that moment. You could develop the virus later on and go on to spread it, you know, throughout those 14 days. There are many virtual options that are available to connect with your loved ones over the holidays. YouTube is out there. You can do a family stream of eating your meal together. Zoom has now removed its time limit for free use on Thanksgiving. There are many apps out there too that you can connect with everyone on. But again, we encourage you to celebrate the positives this year. Remember that you are keeping your loved ones safe by staying home with your immediate family. This is not the year to get everything you want, but rather the year to appreciate everything that you have. So please consider the many ways that you can support our local businesses while also following the COVID safety protocols. So it's very important that we all work together to continue supporting our economy. So several ways you can do this are by buying gift cards by phone or online that you can then mail to family and friends as gifts. Use curbside pickup when picking up your gifts from your local businesses. Order your meal for carryout this year. Maybe this is the year that you're not going to cook and you order a great meal that you have to do nothing but drive to the business and pick it up. Maybe this is the year for that. So again, along with everyone else, I would please ask you to remember our healthcare and our public health workers are no longer the front line of defense. They are now our last line of defense. They have been stretched to the max, and it is up to all of us, every single one of us, to come together to protect them. You, as our community members, must step up and be that first line in flattening the curve as we wait for a vaccine. Thank you.
Thank you, Jody, for those wonderful ideas and your impassioned plea for all of us to step it up. We're going to end this panel presentation with hope. We've heard a lot of the negatives around how bad our situation is right now, although I know you all, like me, have heard all the positives as well, as the resiliency in our community is really on display today and how we're all working together across healthcare systems and public health. We're going to turn now to Dr. Grunwald, who's going to tell us about the hope for a safe and effective vaccine.
Yeah, thanks, Sarah. Certainly, the past several months have really shown us what America is all about, and remarkable things and achievements have happened over these past few months. However, right now, as we've heard on this call and what we know of what's going on in our local regional area, the current trajectory for COVID-19 is an unsustainable one for our citizens and for our healthcare systems. And we all need to pitch in and figure out what is it that we can do individually, like Jody said, to really flatten that curve. We all did it once before, earlier on in the pandemic. We can certainly do it again, but it's really a requirement that we each individually pitch in to get this done. And so now's when I get to give us all some hope after hearing all of this despair that's currently going on, and that's very real. but so is the hope. Early on, when the pandemic started, the plan was to end it with a vaccine. And in remarkable fashion, the United States has managed to create, as of right now, 2 what appear to be very viable vaccines with effectiveness well beyond our greatest expectations. The early data is showing that these may be 95% effective. That is remarkable. And it proves that coronavirus is a bit of an easy target for vaccines, but it means people need to get them and they need to be safe. And the early data is also showing that the vaccines for coronavirus that we've developed for COVID-19 are actually very safe as well. And that vaccine should be coming out in the coming months. However, in order for us to get there with our current rate of infections going on, many people may never make it to that point if we don't pitch in and do something right now. And so I really liken this to what I kind of view as our maximum effort for Sauk County residents. What can we all do that puts those chips all in, that says we need to do something to flatten this curve, and this is how we're going to do it. And with a maximum effort, I believe we can. You know, no one would knowingly go to a Thanksgiving dinner if the building was on fire. It's an obvious threat. Stay out. Coronavirus is an invisible threat. And because you can't see it and feel it when you encounter it, we get a little bit dismissive of it. Rather, it is a very real threat, almost worse than a fire. And so I would encourage you to realize and understand this and stay away from that threat. It is what we need in order to flatten the curve. And with that, I really need to recruit you to be on the front lines for us. This is, as Janelle said, a wartime effort. We need to win this particular battle, so in the end, we can all win the war once the vaccine is available to each and every one of us. And please don't make us be your last line of defense. We're remarkable in what we can do in healthcare, but we can't guarantee our outcomes, and we need to avoid that invisible enemy as much as we can. So really asking for our community members to do what Sauk County has done many times before and put in that maximum effort. Avoid those gatherings, large or small now. The virus is too prevalent for us to think that a small gathering is just as safe. And keep yourself out of those situations and have a safe and healthy holidays virtually, just like we are for this conference.
Thank you, Dr. Grunwald. And thank you to all of our panel members for sharing all of your experience and your insights today. And thank you also for everything you do to keep us safe in our communities. At this time, we are open to questions from the press. You can use the chat box if you would like to enter in your question there, or you can unmute yourself and ask a question. Right now, I am not seeing any questions in the chat. Give everyone about a minute to either enter their question into the chat or to unmute and ask a question. I feel like we should have some nice Christmas carols playing in the background. Maybe in your own head you can do that. All right, we do have a question here from Heather Stanek. What do you recommend for people who don't have reliable internet access? We know rural broadband is a big issue in certain areas. And that is for any of our panelists at this point.
I'm guessing. Go ahead.
Okay. In terms of the patients that we are encouraging to do telemedicine who have comorbidities, if it's a kind of visit we can do telemedicine, we do that. But the Heather Stanek is correct, especially as we get up towards Wisconsin Dells, Adams County area. The internet is not reliable. And so what we do is we convert those visits to telephone And it's the next best thing. Patients are so appreciative. So even for those people who don't have internet, most can do phone contact.
Thank you, Dr. Murphy. Would you like to add anything to that, Jody?
I was just going to say, looking at it from the aspect of Thanksgiving, you know, and not, maybe you don't have access to Zoom. Again, as I spoke earlier, excuse me, you know, this is the year then to just keep it the small family, celebrate what you do have, celebrate the positives. And, you know, with all of us taking these precautions, you know, hopefully next year we can have the big gatherings where we all get together again.
Thank you. I see another question here. What is the best source of information on COVID-19?
I think that's an interesting question. COVID's really complex. And I think it's easy to get trapped into seeing COVID on a hyper-focused level, looking at one small sliver of COVID-19 and equating it to the larger disease process. And so I think what Sean is asking for is, where should our citizens turn to when they're looking for information on COVID-19? And I would say turn to the experts. It is pretty clear on who the experts are. They're the healthcare and our public health officers. Certainly our Sauk County residents, whether it's any of these three health systems, have wonderful experts within their walls as far as how to care for patients. And when it comes to public health, I think we're looking at those people. We have excellent people within Sauk County who are trying their best to keep the citizens of Sauk County safe and healthy. And so when you really want to look at it, turn to those folks. We represent the arm's reach interpretation of your question. And you won't want the fox watching the hen house. So ask our independent individuals to give you advice, and we're happy to help you. We want you to be safe and healthy. That's where to turn when you're looking for COVID-19 information.
Thank you. And I have entered into the chat our website it's our direct web page for coronavirus response. But on the Sauk County website, you can find, under public health, you can find quite a lot of information about how to keep yourself safe, your family, how to access resources. If you're a business owner, you can find guidance there. You can find our top questions and simple answers about coronavirus. You can get free COVID testing information, what to do if you're sick, how you can protect your loved ones, as well as our data hub is located there. So I do encourage you all to visit that. And thank you, Dr. Grunwald, for answering that question. Let's see, other questions here. Rich Bonjour, I think there are a lot of questions about whether or not people can still spread the disease if they've had it in the past.
I think the question really referred to, as I heard it, as, can I get it again? And I think we don't know that, except to say that there are documented cases of people getting ill with COVID after they've already been ill. The general thought is right now, and Eric, Nathan, Dr. Hupp, if you have any other things to add, is 3-month window. We believe that there's adequate antibodies to protect you, but everybody's mounts a different amount of antibodies depending on how big a viral load you receive is going to be, and then how good of a robust immune system you have. So our ask is that if you've had COVID, please don't throw caution to the wind and believe that you're like a super person who can't ever get it again, because we do not know enough about this. But I'd like to hear if any of the other physicians have other thoughts on that.
Yeah, so I mean, it's a good question. I think both Eric and Maureen, you're both right kind of on maybe what Rich was asking, but so there's a good research study that showed while most people by 10 days after their infection are no longer shedding live virus, the longest person in that study was up to 83 days that they were still shedding live virus. And so while that doesn't represent the majority of people by any stretch of the imagination, it points out that we don't exactly know, as Maureen pointed out, where exactly does COVID-19 live in our bodies over the long duration. And we are seeing early on, we were worried about our immune system response to COVID-19. Is it durable? Is it going to last for a long time? Are people going to need this vaccine every year type stuff? Well, it turns out that we are actually mounting a very robust immune response. Some people, it takes longer than others. Early on, people with mild infections seem to have a lower immunity early on, but as time went on, they built up those long-term memory cells that can re-invoke their response if they see the virus again. People who were really severe early on kind of had that overwhelming response and it came out big and hard early on and made them super sick. So from that standpoint, it does seem like you can still shed live virus for a while. And then can you get reinfected? I think, as Maureen pointed out, it is documented in the world of reinfections of slightly different variants of it, but it turns out that it doesn't seem to be very common. And so we're hopeful that people aren't going to get reinfections at least frequently enough that we have to worry about in massive pandemic sort of ways, which is really good. And to the point of if you've had it before, what do you have to do? Right now, because of the shedding, we don't really know, but we still recommend that individuals still wear a mask, because just like the flu vaccine, when you get the flu vaccine, it doesn't mean that when you're exposed to the flu that it doesn't replicate in your mucosal membranes and that you can shed some live virus. You actually can. The point is you don't get really sick, and that's the key between vaccinated status and not. So COVID's the same. For now, we need people until we can get this under control to mask, even if you've had the virus previously.
I would agree with all of that. And we see evidence of variable response, immune responses, even in the vaccines that we know well. For instance, a person can get a 3-shot hepatitis B series and still we titer them before we hire them at a hospital, and they don't have immunity to hepatitis B. So we all mount immune responses in different ways, and some of us more robustly than others. So yeah, I think we have to use caution and not just assume that we're safe because we've had this once.
Excellent. I see another question here from Heather Stanek for Teresa Field. Do you have a rough idea or percentage of how many patients in ICU have or have had COVID-19 at Reedsburg Area Medical Center?
Okay. Well, I would not be able to speak specifically to the statistics or the numbers, but what I can tell you is that our ICU census has been significantly higher, especially in the last 2 months, and a high percentage of our ICU patients are positive COVID patients. I think the important thing to also realize in addition to that is not only are we seeing very sick ICU level COVID patients, we're also seeing sicker, just sub-ICU level COVID type patients, so more intermediate care and even med-surg level types of care that are just much longer admissions than we're typically used to seeing. So the patients that we we're seeing are sicker, they stay sicker longer and require significantly more care than we're used to really having to give under normal circumstances. So I think definitely our resources are definitely being used at a much higher rate than we could say was the case 10 months ago.
And Sarah, can I just add to that? I think that it's really important. I think it's come across on this call, but I want to make it abundantly clear to Sauk County residents. All 3 of these systems have seen and are taking care of COVID-19 patients. I've heard from some individuals asking, well, are you guys even do we see COVID-19 here? Are you guys having to care for these patients? And the answer overwhelmingly is yes. It is here. It is real. Our health systems are seeing these patients every single day. And I think part of that is because early on, how we felt about COVID-19 was set by what happened in New York. We saw this overwhelmed city with health systems, with morgues being set up outside. And that's really how our citizens in the United States had their early barometer on COVID-19 set. But the reality is, in rural America, the experience is different. It took a while for it to get to us. It is here now. And while we aren't having our systems burst at the seams at the moment, we are very close to having that potential happen here. We are trying at all costs to avoid that. So it's here, it's real, and we're all dealing with that. And I hope people take that message and share it.
Thank you. Last call for questions. Okay, hearing none, thank you all so much for joining us today for this call to action. Please do take action, be a leader in your community, in your work environment, in your family, to take heed to all that has been shared today about how we each need to take these appropriate steps to flatten the curve and become the frontline workers in the fight against COVID-19. So thank you all for your time. Happy holidays. Have a wonderful Thanksgiving. And please do reach out to us as public health and as healthcare systems with your questions. Have a good day.
Thank you, everybody.
Thank you.
Thank you, Sarah.
Thank you.
Thanks.